Today in midwifery class, we will discuss a very important topic, that is female pelvis. Female pelvis topic is discussed in theory as well as in practical, and you may get questions in both forms of examination. This is a very vast topic and we will cover this topic in two parts. So today we are discussing part 1 and tomorrow maybe part 2. So be ready. What is female pelvis? So when we talk about bony pelvis or female pelvis, we are supposing or we are thinking about normal female pelvis. Normal female pelvis is a gynecoid pelvis which is round inner through which the fetus passes during the process of birth. So here you can see this is the gynecoid pelvis, and through this fetus passes during the delivery. As it forms a bony canal, that's why we call it bony pelvis. Why do we study about female pelvis? Especially the students of midwifery, it is very important. Knowledge of pelvic anatomy is needed for the process of or conduction of labor or delivery, as one of the way to estimate the progress made during the delivery. So during delivery we assess the relationship of fetus to certain pelvic landmarks. So when we will know about bony pelvis, we can find out the landmarks during the delivery process, and we can assess the progress of labor. A midwife must be competent to recognize a normal pelvis in order to be able to detect deviation from the normal and refer them to doctor, because if the pelvis is not normal, normal delivery will not be possible, and we have to send the client for cesarean section to a doctor. What are the functions of pelvis? So when we study about pelvis, we should know what are the functions anatomically and from the midwifery point of view. The primary function of pelvis is to allow movement of the body at hip joint, especially during walking and running. So this is primary function. Then pelvis also permits the person to sit and kneel. When we are sitting on the pelvis. It is adapted for childbearing because of its increased width. Especially female pelvis has more width than male. So it is rounded brim and delivery is possible. And due to this widening of the female pelvis, women are less speedy than men, means they can run slower than the males, but it is adapted for childbirth. Now we come to next function. It transmits weight of the trunk to legs. Actually, there is a junction point when whole body's weight is on pelvis and pelvis transmits the weight to both legs. Act as a bridge between the both femur bones. This makes it necessary for the sacroiliac joint to be immensely strong and immobile for holding the weight of whole body. It also takes weight during sitting position, because when we sit on the ischial tuberosities which are part of bony pelvis. It also provides protection to the pelvic as well as to some extent abdominal organs also. The sacrum transmits or give rise to cauda equina and distribute the nerves to various parts of the pelvis. So these are the basic functions of pelvic cavity. Now anatomically we will discuss what are the bones which forms pelvis. So basically 4 pelvic bones are there which take part in making the pelvis. These are two innominate bones or hip bones. We have already discussed in previous classes of anatomy. One sacrum and one coccyx. So these four bones form the pelvis. Here you can see in this picture also. This is sacrum, these two hip bones, and one coccyx just below the sacrum. Now we will discuss them one by one in detail. Each hip bone is composed of three different parts: ilium, ischium, and pubis or pubic bones. So in this picture you can see this is upper part is ilium, lower part is ischium, and front part is pubis or pubic bone. We will discuss them one by one. First is ilium. Ilium is large flared out part. So here this is flared out part. So this is ilium. Okay. When we place our hand on the hip bone or hip joint, the upper part which we feel, that is known as iliac crest. Okay, or we can say iliac crest is the upper border of ilium. So this is the iliac crest starting here to here. And anteriorly at the front of the iliac crest there is a bony prominence known as anterior superior iliac spine. So this one is anterior superior iliac spine. Then a short distance below here there will be another bony prominence known as anterior inferior iliac spine. So here superior one and here inferior one, both are interior iliac spine. There are two similar points at the back or other end of the iliac crest here, and they are again named as posterior superior iliac spine and posterior inferior iliac spine. So four iliac spines are there, two anteriorly and two posteriorly. Then there is a large space that is concave anterior surface of the ilium is known as iliac fossa. Okay, so anteriorly there will be iliac fossa here. Okay, this one is posterior aspect and this one is anterior aspect. So this will be iliac fossa. Then second part is ischium. This is thick and lower part. Then this lower part is very strong, and when we sit on the ischial tuberosity. Behind the ischial tuberosity there is a projection known as ischial spine. So this one is ischial spine. During labor or at the time of labor when we do pelvic examination, the station of fetal head is estimated in relation to ischial spine. So ischial spine is very important. Then third part is pubic bone. It forms the anterior part. Okay, it has two oar-like projections, superior ramus and inferior ramus. So here we can see this is pubic bone, this one is superior ramus, and this one is inferior ramus. The pubic bones meet at the symphysis pubis. So when these two bones meet together here, they form the joint which is known as symphysis pubis. And inferior ramus of both bones, they form an arc known as pubic arc. So this is the pubic arc, and they also attaches to the ramus of ischium. So this is ischial ramus, this is pubic ramus, and they both form the attachment, and there is one foramen in between them known as obturator foramen. The space or hole enclosed by the body of pubic bone and ramus of pubic ramus, pubis, and the ramus of ischium, that is called obturator foramen. So this one will be obturator foramen. The innominate or hip bone contains deep cup-like structure outwards, and that cup-like structure is known as acetabulum, and this acetabulum holds the head of femur and forms hip joint. On the lower border of innominate bone, there are two curves. Okay, posteriorly. One is larger curve above the sciatic spine or ischial spine. This is known as sciatic notch or greater sciatic notch. Okay, just above the ischial spine. And there is smaller one, small notch below the ischial this spine, and that is known as lesser sciatic notch. So this lies posteriorly or down below the posterior inferior iliac spine. Then next bone is sacrum. Sacrum is wedge-shaped bone consisting of 5 fused vertebrae. Okay, so the vertebrae which are below L5, they form the sacrum and they are fused to each other. The upper border of first sacral vertebra is just forward here, protruding forward, and this point is known as sacral promontory. Okay, so from sacral promontory, the sacrum starts. The anterior surface of the sacrum is concave. So this one is anterior and this one is posterior. So anteriorly it is concave, and this concave part is known as hollow of the sacrum. And laterally there are wing-like structures. These are known as wings or ala of the sacrum. There are 4 pairs of holes or foramina pierci, the sacrum through which the nerve fibers come out from cauda equina. So these are the holes or foramina pierci or sacral foramina, we can say. These nerves come out and they supply the pelvic organs. The posterior surface is roughened, and these are roughened due to for receiving the or for attachment of muscles. So posteriorly muscles are attached, ligaments are attached here. Easily we can find this is concave, this is anterior surface, and this is convex posterior surface. Then another bone is coccyx, third part. The coccyx is a vestigial tail, this one. It consists of 4 fused vertebrae. Okay, so last 4 vertebrae for our vertebral column, they are fused to each other and are known as coccyx. This coccyx is small triangular, roughly triangular shaped bone which articulates with the 5th sacral vertebra. So here there will be sacral coccygeal joint. Now we will discuss about pelvic joints. There are 4 pelvic joints. Okay, whenever a question is asked, okay, explain about pelvic joints, first thing should come in our mind that there are 4 joints. One, symphysis pubis, very important in midwifery also. So anteriorly there will be symphysis pubis, 2 sacroiliac joints here, 1, 2, and 1 sacrococcygeal joint. Okay, we will discuss them one by one. The symphysis pubis is the joint formed by the junction of 2 pubic bone. Okay, so one this hip bone, 2 second this hip bone. Okay, or these are the pubic part of these hip bones. So when both pubic bone attaches to each other and there will be a fibroelastic cartilage in between, so this joint is known as symphysis pubis. Next is sacroiliac joint. Sacroiliac joint, as name suggests, sacrum and ilium. The joint will between sacrum and ilium is sacroiliac joint. So 2 sacroiliac joint will be there. This one is right and this one is left. Okay, these are strongest joint in our body. Okay, and because they bear the weight of our body, they join the ilium join sacrum and connect the spine to pelvis. So our spinal cord or the vertebral column is attached to the hip bones. So this After attaching these joints are formed and all these four bones form bony pelvis. Third one, sacrococcygeal joint. Sacrococcygeal joint is formed at the base of the sacrum. Okay, and coccyx articulate with the tip of the sacrum. So this is tip of the sacrum and this is coccyx. So this joint is formed here. So these four joints are called as pelvic joints. Actually, in non-pregnant state of female pelvis, there is very little movement in these joints. But during delivery, at the time of delivery, due to endocrinal activity, the ligaments become softened, which allow joints to move slightly. Slight movement will be there at the time of delivery. This may provide more room for the fetal head to pass through the pelvis. And it is very important that fetal head pass safely. That's why we in midwifery we study about pelvis as well as fetal skull, landmarks of the fetal skull as well as the landmarks in the pelvis. The symphysis pubis also separates slightly in during later pregnancy, which also allow the movement of fetal head. It widens appreciably. During the movement, there will be pain. When the lady is walking, pain may be there. So this should be considered during assessing the pain. The sacroiliac joint allow a limited backward and forward movement. Okay. The movement at the sacroiliac joint will be slight when the coccyx sacroiliac joint will be forward and backward movement. Okay, and this is also known as nodding of the sacrum. Okay. The sacrococcygeal joint also permits coccyx to move backward at the time of birth of the head. So these movements are possible only at the time of delivery. Otherwise, these joints are fixed. But later they become slightly movable. Now we will discuss about pelvic ligaments. Okay, the study of ligament is also very important because these are the ligaments which provide slight movement at the time of delivery. Each pelvic joint is held together by ligaments. As we know, during anatomy we have studied the ligaments are the fibrous tissue which hold the joints together. They attaches bone to bone. Okay, at every joint there will be ligament. So what are the ligaments in the pelvis? So interpubic ligaments at the symphysis pubis. Okay, so this is the symphysis pubis joint. There will be interpubic ligaments. Then sacroiliac ligaments, okay, at this joint, and sacrococcygeal ligaments at this joint. Okay. There are some other ligaments which are important in the midwifery. These are sacrotuberous ligament and sacrospinous ligaments. These are special ligaments. We will discuss them here. The sacrotuberous ligament run from the sacrum to the ischial tuberosity. Okay. So this one will be sacrotuberous ligament. And sacrospinous ligament, as name suggests, it starts from the sacrum and goes up to the ischial spine. This one, sacrospinous ligament. So both ligaments, they form the part of pelvic outlet. Okay. These two ligaments, sacrotuberous and sacrospinous, they cross at the sciatic notch and they form the posterior wall of pelvic outlet. The pelvic joints are held together by these very strong ligaments and are designed to not to allow movements. However, during pregnancy or at the time of delivery, the hormone relaxin is secreted, which gradually loosens these ligaments and provide some movement in the pelvic and provide more room for fetal head to pass through the pelvis. So this is the anatomy of female pelvis. In next class, we will discuss about the landmarks of the pelvis. Thank you.